High blood pressure, the silent killer. You might be taking your meds and cutting back on salt, yet your readings are still creeping up. Why? The truth is, there are hidden everyday habits that could be driving your blood pressure through the roof. In this video, I'll reveal 5 little-known causes of hypertension, especially relevant for men over 60. These aren't the usual eat less salt, lose weight advice. You already know that. I'm talking about surprising things like a common pain pill in your cabinet and a missing nutrient that might be undermining your efforts. Stick around for number 1, the most neglected factor, which could be the key to finally getting your blood pressure under control. Give a thumbs up if you're ready to take charge of your BP, and let's get those numbers down. Cause number 5, daily pain relievers, the NSAID blood pressure trap. Got aches and pains? Many of us pop an NSAID, non-steroidal anti-inflammatory drug, like ibuprofen or naproxen regularly for arthritis or headaches. But here's the shocker. These common pain relievers can raise your blood pressure. NSAIDs cause the body to retain sodium and water and can make blood vessels less flexible. Studies show that in older patients, NSAID use can increase blood pressure by about 5 millimeters of mercury on average, and even more in some individuals. If you have hypertension, that's the last thing you need. They can also blunt the effect of some BP medications. This doesn't mean you must endure pain, but you should be aware of this hidden effect. Solution: use the lowest effective dose for the shortest necessary time. Better yet, consider alternative pain management. Acetaminophen, Tylenol, does not raise BP like NSAIDs. Just be mindful of liver dose limits. Non-drug therapies like ice, heat, physical therapy exercises, or topical creams patches for pain can also help reduce the need for NSAIDs. If you absolutely need to take NSAIDs regularly, talk to your doctor. Maybe your BP meds need adjusting, or there may be safer alternatives. The key is to not take daily NSAIDs blindly, without recognizing their impact on blood pressure. Cause number 4, hidden salt in healthy foods. You've tossed out the salt shaker. Great. But are you still getting high sodium from foods that don't even taste salty? Probably. Processed and packaged foods are the stealth sodium bombs in most diets. Bread, soups, deli meats, canned vegetables, sauces, they often contain shocking amounts of salt as a preservative or flavor enhancer. Even that healthy canned tomato soup or low-fat frozen dinner can pack more sodium than a bag of chips. High sodium intake makes your body hold on to water, which boosts blood volume and pressure. It also stiffens your arteries over time. The American Heart Association recommends under 1,500 to 2,300 milligrams of sodium a day for most adults, but the average person consumes over 3,400 milligrams. Solution: be a food label detective. Look at sodium content per serving. You'll be amazed. A single can of soup can have 800 plus milligrams of sodium, half your daily limit. Opt for low sodium or no salt added versions of canned goods. Rinse canned veggies or beans. It can cut some sodium. Cook at home using herbs and spices for flavor instead of relying on packaged sauces. Limit processed meats. Consider fresh lean meats or smaller portions. And yes, you can indulge in a little salt on fresh foods if you cut out the giant hidden sources. Your taste buds adjust in a couple of weeks to lower salt, and you'll start tasting the real flavors of food again. By reducing hidden sodium, you can drop your systolic BP by several points within weeks. Some folks see 5 to 10 millimeters of mercury improvements just from salt reduction. Cause number 3, potassium deficiency, missing your natural BP balancer. We always hear too much salt raises blood pressure, but the other side of the coin is just as important: too little potassium. Potassium is a mineral that helps relax blood vessels and signals the kidneys to excrete more sodium. It's like nature's blood pressure antidote. Diets high in potassium are strongly linked to healthier blood pressure levels. Unfortunately, most older adults don't get enough potassium, because we tend to not eat enough fruits and vegetables, the richest sources. Moreover, food processing strips potassium out. The result? A potassium deficit that makes any sodium in your diet hit harder. Solution: boost your potassium intake through foods. Do this especially if your doctor has not advised against potassium for a specific reason, like kidney issues. Always check if you have kidney disease or are on certain meds. The recommended goal is around 3,500 to 4,700 milligrams of potassium a day. Great sources include bananas, oranges, avocados, potatoes, especially with skin, spinach and leafy greens, beans, tomatoes, squash, yogurt, and nuts. For example, a banana has approximately 400 milligrams, a cup of cooked spinach approximately 800 milligrams, a baked potato over 700 milligrams. Even milk and coffee have some potassium. You can easily get there by incorporating these foods each meal. As you raise potassium, you'll likely notice your blood pressure respond. One meta-analysis found that increasing potassium intake significantly reduced blood pressure in people with hypertension. It's like giving your body the tools to push back against high pressure. Of course, if you have a condition like kidney disease, follow your doctor's guidance on potassium. That's the one scenario where you might need to limit it. Cause number 2, chronic stress and poor relaxation. Always in fight or flight. Do you find yourself frequently tense, anxious, or unable to unwind? Chronic stress can absolutely contribute to high blood pressure. When you're stressed, your body releases adrenaline and cortisol, hormones that make your heart beat faster and constrict your blood vessels, temporarily raising BP. That's okay occasionally, but if you're always stressed, work, finances, caregiving, the nightly news, your body might be in a semi-constant state of fight or flight. Over time, this can lead to sustained hypertension. Studies have shown that people with higher perceived stress levels have a greater incidence of developing hypertension over years. Plus, stress often leads to other BP-boosting behaviors, like poor sleep, drinking alcohol, or overeating comfort foods. Solution: while we can't eliminate all stress, we can change how we respond to it. Make relaxation a daily practice. Deep breathing exercises, slow diaphragmatic breathing for a few minutes can quickly lower blood pressure acutely. Meditation or prayer, Tai Chi or yoga, or even simple hobbies that calm you. Gardening, walking the dog, listening to calming music. Physical activity is a terrific stress reducer as well, killing 2 birds with 1 stone. Ensure you have social support. Talking with friends or a counselor can help you process stress better. Also, prioritize sleep. As we covered in video 3, good sleep helps mood and BP. Some biofeedback devices and apps can guide you through relaxation exercises and show your heart rate BP lowering in real time, which can be motivating. The key is to break the cycle of constant tension. Your arteries will relax when you do. Think of it this way. Every evening, consciously set aside wind down time, even 15 minutes of calm breathing and muscle relaxation. It can make a measurable difference. Some people see a drop of 5 to 10 millimeters of mercury in blood pressure with consistent stress management techniques. Cause number 1, lack of exercise. A weak heart working harder. We've come full circle to the basics, but with a twist. The most underrated cause of high blood pressure is a sedentary lifestyle. When you rarely exercise, your heart muscle isn't conditioned. A weak heart has to pump more times to circulate blood, and your blood vessels stay stiff and inflexible. Regular exercise, especially cardio, makes your heart stronger, so it pumps more blood with each beat, meaning it doesn't need to beat as fast, and your arteries more elastic. It's common for sedentary individuals to have higher resting heart rates and higher BP. In contrast, fit individuals often have lower resting heart rates and lower blood pressure because their cardiovascular system is efficient. Solution: get moving in a way that's safe and enjoyable for you. Aerobic exercise is the best for blood pressure. Activities like brisk walking, cycling, swimming, or even dancing for at least 30 minutes a day on most days. If 30 straight minutes is too much, split it into 2 15-minute sessions. The goal is to get slightly out of breath and break a light sweat. That tells you you're working your heart. Consistency matters more than intensity. You don't need to run marathons. Even walking 30 minutes daily has been shown to significantly lower blood pressure in hypertensive individuals. Strength training a couple times a week is also helpful. Building muscle can aid weight loss and improve overall circulation. Just avoid holding your breath during lifts. That can spike BP momentarily. If you haven't exercised in a long time, check with your doctor first and start slow. But do start. Consider it part of your prescription. Within a few months of regular activity, many people see their systolic BP drop by 5 to 8 points, and sometimes they can even reduce medication under doctor supervision. Think of exercise as oil for the Tin Man joints and medicine for your arteries. It keeps everything limber, smooth, and efficient. Plus, it tackles other causes we mentioned. It reduces stress, helps with weight, improves sleep, and raises good hormones. Truly, it's the best holistic blood pressure remedy. High blood pressure may be common, but you have more power than you think to control it. By avoiding these 5 hidden pitfalls: NSAIDs overuse, stealth sodium, low potassium, chronic stress, and inactivity, you can give your blood pressure a significant nudge in the right direction. Do any of these sound familiar to you? Let me know in the comments which one you're going to work on first. Start with 1. For example, add 2 servings of fruits, veggies a day for potassium, or commit to a 15-minute walk each morning, and you'll likely see improvement at your next BP check. Always work with your healthcare provider when adjusting lifestyle and medications, but many doctors will cheer to see a patient take these steps. I know I do. If you learned something new today, please subscribe to the channel. I'm here to help you uncover every angle of healthy living so you can enjoy those golden years with vitality. Remember, take care of your arteries and they'll take care of you. Stay healthy and keep that pressure down. Thousands of seniors have found this video helpful, so I highly recommend you watch it. Click to keep going.